Sarah. Thank you so much for coming in today. How are you doing?
I'm good.
Yeah?
Yeah.
Has it been a good day at work?
I think so, yeah. I've had a good time.
Good.
Yeah.
I'm so glad. So overall, kind of looking back on the past, 8 weeks or so, how do you think the placement has gone so far?
It's been good. I've never been in acute, care rehabilitation, so there's definitely some new things. But I think I'm learning a lot. It's hard. It's hard sometimes. I don't always know everything that's going on, but I feel like I keep up pretty good.
Okay, good. Are you enjoying it? Is this somewhere that you would like to see yourself working, or is there somewhere else?
Personally, I would rather be in a school setting or somewhere with kids, I think. So yeah, not necessarily where I see myself ending up.
Okay.
Yeah.
Do you have any data for me about being on time for your clients, or completing your daily paperwork, or your typical preparation? I know that was our goal for last time.
Yeah, we did talk about time stuff. I've tried to be on time more, so I've tried to go and just make sure I'm there, when the client gets there, not come in late. What were the other things that we were working on?
Have you been completing your daily paperwork at work, or have you brought that home, or what have you done?
Yeah, I usually have to take it home and do it in my car, or find time to do it afterwards. I just don't have a lot of time when I'm here to get it done.
Okay. And then can you tell me a little bit about how you prepare for a client session?
Yeah, so we took a class where we learned some things about what we do in this setting. So I usually just think back there and think oh, they have this, and I learned how to do this. So a lot of times my planning I do in my head before a client.
Okay. So most of the time in the acute rehab setting, we at least have to have the goals for the individual clients, and then we actually have to write out our treatment for them and kind of plan that out. So I know as a future speech pathologist, you're going to have to do that, especially for billing purposes. So if you could go ahead and start doing that now, that would be great. So the next time that we come in another 2 weeks, I would like for you to have some journals just about the clients.
What I did with them.
Exactly, exactly. And I think it would be really great if you could do your planning either before the day begins or the night before, to think about getting appropriate materials and things like that for them as well.
Yeah.
Can you tell me, or think back on the things that you have done really well?
I think I'm good at interacting with coworkers. I think I'm becoming friends with some people. I like to see them. We know each other's names, so I think that's been something that's been good. I think my therapy is pretty good. I think once we get going, I can interact with the client and offer them quality services once I get in there.
Okay. Well, I definitely have noticed you've gotten a lot better at selecting therapy materials for the clients. So I think that goes into what you were saying about, providing them with good care. I've noticed that your daily goals for the patients have definitely improved, just in their wording, and then I think your thought process as well is what's most appropriate. And then I've definitely noticed an improvement in your administering of assessment tools on clients as well, for sure.
Yeah, that was hard because I hadn't done a lot of assessments for this population of people.
I understand that. Yeah, definitely. Can you talk about the things that you still feel you're struggling with?
Yeah, I think getting paperwork done has been really hard for me. I love the part of our job where you do therapy, and I love the people, but just doing all the paperwork is really time consuming. I don't feel I have a good method of getting it done, and so it just takes a long time, and so that's something I've really struggled with. But other than that, I think everything's been okay.
Okay. Well, something that you said about getting to know your coworkers and things like that, I think what I have to do is I have to be super conscious. It's so easy, and I think it's wonderful that you're becoming friends with your colleagues, but it's really easy during the day, like in transitioning from one patient to another, to like stop and talk to someone. But sometimes we just don't have the time to do that, and we have to go from one thing to another. And so that's what like our lunch breaks are for. So maybe that would help improving, being on time to visiting clients, and it might even improve like preparation for interacting with clients too. But I know that's hard because you just want to be friends with them. Like going into this profession, you're definitely a people person. So, so what I really wanted to focus on today was talking with you about Anderson's Continuum of Supervision. Have you ever heard of that before? No? Okay. So basically, what it starts off as, you recognize that the supervisor knows a lot more than you, and so like you have a limited knowledge. The supervisor has a lot of knowledge that they're willing to share, and so when you start off in the therapy setting, what you want it to look like is that the supervisor is contributing a lot more than you are. But since we're farther along in the acute rehab setting for you, what I need it to look like is that you are carrying most of the weight, and that I'm doing just a little bit to help you out with your clients. And like I said, you're definitely improving, but I do have some concerns, just because I think it would be really difficult if you were to have to graduate right now and go out, which I know you're about to graduate. You're going to go into a CF that you're going to have to interview for, and you're going to be on your own for the most part. So it's going to be completely hands-off. So at this point, I feel comfortable with you administering assessments, like setting daily goals for patients and selecting therapy materials. But the things that I have really concerns with are still being on time. Because here, it's not okay, but, like we're tolerating it. You're still in school. You're improving on it. You're getting better. But when you're in an actual job, that's not going to be able to like be handled appropriately. So completing daily paperwork at work, you have to get that done. That's just kind of like a standard for our profession. And so just being more aware of your time management skills and completing those things. And then your typical presentation or your preparation for a client session as well. I think there needs to be some more thought that goes into that, and more thought going back into the daily paperwork as well, just being able to write all of that stuff out. So I kind of wrote some, I just got lost in my notes, I'm sorry. So in the future, I really want you to be able to feel 100% comfortable with the assessments, with the time management, with your paperwork and your preparation for clinic. So I think those are the 4 things we need to focus on. Is there something that I'm missing that is like contributing to these things? Because I think we should be a little farther along in the process than we currently are. Is there something that I don't know about that I could be helping you with, or?
No, I mean, you recognize, like, I am in school, and I'd say that's where the rest of my time is going. But other than that, those are really the 2 main things going on right now.
Okay. Well, I'm going to get a pencil really quickly, but I really want us to write down some goals for us, for me to be following up with you, but just to keep you accountable as well.
Great.
So let me get my pencil. I'm sorry I didn't have that before.
That's okay.
Okay, so I said that I wanted it to focus on time awareness, your interpersonal communication skills, your ability to strongly make clinical decisions independently, and just encourage independence with the clinical assessment. So, do you have some ideas about how you can be improving time awareness?
Maybe have like just a watch alarm that goes off, like beeps a couple times before, like 5 minutes before a therapy session. So if I am working on paperwork or talking with someone, I know it's time to go.
Okay. So watch alarm 5 minutes before a session ends. That's great. I had actually written down something similar as well for you. So I would really like to see some data. I know we didn't have that for this time, but some data indicating like how timely you were. So just for you to indicate, and just be honest with me about it. Like, I'm looking for improvement here, not perfection. So every day that you come in late, mark that for me. Or every session that you come in late, mark that for me, just so that we're actually able to see. So our overall goal, I want you to be on time to a session 8 out of 10 times for every session and for every day, which there will be 10 days before we meet again. So that works out well. So just being able to make clinical decisions confidently. What are some ways that you think you could improve on that, or what are some goals that we can come up with?
Maybe a way to improve would just to maybe find a time to watch you make some decisions and take notes about them, and then maybe talk about it, and so talk about how I can kind of make decisions with a similar confidence.
Okay. So watching me, we can definitely schedule some time to do that. I think one of the best ways to practice confidence, I will tell you, is just acting confidently. And whether that's an internal feeling or not, you just have to act like you are confident, because nobody wants in the future, you know, when you're doing this for real, their SLP to come and be like I'm pretty sure that this is, you know, what you have, or I feel pretty good about your test results, but I'm going to go consult with another SLP. They want someone who knows what they are talking about. And that doesn't mean that you can't be receptive to someone correcting you, but that does mean that you need to feel like you are appropriately shepherding your client, if that makes sense.
Yeah.
Okay, so watching me, let's try to get you in for like 2 to 3 of the new clients that I'm going to get next week. Make sure I penciled that in. Okay. And then how can I encourage you with your independence in the clinical assessment tools? What are some ways that we can improve?
I think that's something like to just continue doing them over and over again. So maybe if there's an opportunity that you have with a client that you're working with, to allow me to use those assessment tools with them just to get more familiarity with them.
Definitely. Do you feel confident in your knowledge of like what each assessment tool measures, or like what it
I feel like
gears toward?
I know what it's for. It's just the administering part that I get nervous about.
Okay. Yeah, I totally understand that. So more practice administering. Okay. I also would love to have you come in and see when I counsel and like diagnose, which I think that would be great in the clinical decision making. We could follow up probably with the same people and give them a diagnosis as well. But I think counseling is really an art form, and it's something that we definitely have to continue to work on to improve ourselves. So just being able to nurture and care for those, but also in a professional way. So hopefully I'll try to get those same clients to let you come in as well.
Yeah, that can be hard, just figuring out. I don't always know exactly how is the best way to say it. It's like I know what I need to say, but I either get nervous or just don't feel comfortable telling them. So I would like to watch you do that.
Okay, definitely. Yeah, we can make that happen. All right, I think that covers it. So I'll email all of this to you, but we want to work on time awareness, just being there on time 8 out of 10 days, and for every 8 out of 10 sessions as well. And then are you going to set your alarm?
Yes, I'll do my watch alarm.
Perfect. Yeah, and then I'll schedule the sessions for you to come in on and for us to discuss and do some assessments.
Good.
So, all right.
Thank you
so much,
Miss
Sarah.
Springer.
Oh my God.